Well, good afternoon, everyone, and welcome to our daily briefing. I'd like to begin today with a medical update from Dr. Ngozi Ezike.
Good afternoon, everyone. Today, IDPH reports 3,137 new cases of COVID-19 here in Illinois, for a total of 56,055 across the state. This unfortunately includes a total of 2,457 deaths, of which 105 were reported since yesterday. To date, we have run 284,688 tests, with 14,821 being performed in the last 24 hours. Regarding hospital data, as of yesterday, 4,900 people were in the hospital with COVID-19. Of those 4,900, 1,263 patients were in the intensive care unit, and 777 patients were on ventilators. Putting on my pediatrician hat, I'd like to remind parents and guardians to make sure that you're staying up to date with your children's vaccinations and their regular checkups. Please check in with your pediatrician or your pediatric provider to learn the guidelines that you need to follow in order to make your visit as safe as possible. In addition to needing to see the doctor when you're sick, these well visits are critical for monitoring growth and development. We assess hearing and vision. We check for lead exposure. So these checkups, as well as the vaccinations that are attendant with those, are very critical. When you are visiting the doctor, please remember to wear your face covering and for your older children as well, so that you can minimize the spread of droplets and aerosols, and others should be doing the same to protect you. And putting on my adult physician hat, I'm asking adults, you need to take care of your health as well. I know many people are taking advantage of telehealth visits, but if your doctor says that you actually need to come in to follow up, either on your high blood pressure or your diabetes, please take the necessary precautions and proceed with your critical doctor's visits as well. We must make sure that we get all the care that we need to keep ourselves as healthy as possible. All of this is important as we continue to stay well, to stay safe, and stay home. Thank you for your attention. Now I'll repeat my comments in Spanish. Buenos tardes y gracias a Gobernador Pritzker por su liderazgo firme. Hoy estamos reportando 3,137 nuevos casos de COVID-19 aquí en Illinois, para un total de 56,055 casos. Esto incluye un total de 2,457 muertes, de las cuales 105 fueron reportados desde ayer. Hasta la fecha hemos realizado un total de 284,688 pruebas para COVID-19, con 14,821 realizadas en las últimas 24 horas. Desde ayer había 4,900 personas en Illinois estaban en el hospital con COVID-19. De ellos, 1,263 pacientes estaban en la unidad de cuidado intensivo y 777 pacientes estaban en ventiladores. Como yo soy pediatra, me gustaría recordar a los padres y familias que se aseguren de estar al día con las vacunas y los chequeos regulares de sus niños. Consulte con su pediatra para obtener instrucciones sobre cómo visitar una oficina en manera segura. Deben ir por sus chequeos y por sus vacunas para ayudarlos con su desarrollo y crecimiento. Eso es muy importante. Si está visitando al médico, use una cubierto facial. Y como yo soy doctora de los adultos también, adultos, usted también deben vigilar su salud. Se necesitan sus chequeos por diabetes, alta presión o algunas condiciones que tienen. Podemos tomar todas las medidas prevenidas en el mundo, pero si descuidamos nuestra salud, todos seremos más susceptibles a contractar COVID-19. Quédanse bien, quédanse seguro y quédanse en casa. Gracias. And with that, I will turn it over to Governor Pritzker.
Thank you very much, Dr. Ezike. And I want to introduce you all to a new face, as this likely won't be the last time that he joins us for one of our public updates. That's Dr. Wayne Duffy, MD, PhD, a trained epidemic intelligence service officer with the Centers for Disease Control, who has led multiple initiatives within the agency, most recently as a senior medical advisor in the CDC's Division of Global HIV and Tuberculosis. Dr. Duffy has stepped in at IDPH as our acting state epidemiologist and has primary responsibility for our contact tracing initiative. I've talked before about our ability to test and trace and how critical it is as we move from our stay-at-home order towards a new normal. The importance of testing has been a major topic over the last few weeks, including yesterday. So today's focus is on that second T, tracing. Tracing, or contact tracing, is one of the most critical tools that we have to reduce our spread rate, speed up our diagnoses, and seek to halt outbreaks before they happen. But let's start with the basics. What is contact tracing? Well, it means making sure that you get notified if you've had contact with someone who has tested positive for COVID-19, so you can do what's necessary to keep you and your family and your community safe. Contact tracing means we will let people know before symptoms start that they could become ill. In the context of a very infectious virus, this is our primary tool for identifying potential asymptomatic spreaders so that they can self-isolate quickly and slow the spread of the virus to their contacts, keeping more people COVID-free for longer. And that last factor is key because it demonstrates why contact tracing is so important to all of us together. It means a reduced rate of spread, fewer outbreaks, and an all-around healthier Illinois. Contact tracing isn't a new concept. It's been around for many years, and Dr. Duffy will talk a bit more about that history. The difference now is that in order to move safely back toward normalcy, Illinois, the United States, and frankly the whole world must contact trace on a never-before-seen scale. Contact tracing has played a role in our COVID-19 response since the earliest days of this pandemic, as local health departments around the state have aggressively sought out each COVID-positive person to identify all their close contacts and then encouraging those contacts to opt into monitoring programs and to follow recommendations. That was when we had a manageable number of cases and contacts that county health departments' existing staffs could handle. Of course, as we all know, over just the last few weeks, COVID-19 has reached a massive scale of spread statewide and nationwide, and existing public health management infrastructure simply can't keep pace. No doubt, as we all live through this pandemic, I think we'll all have a lot to consider about our failure to invest in public health in this country, but we'll save that conversation for another day. Right now, we have to deal with what's right in front of us, and that's getting to the other side of this crisis. Here in Illinois, we've had more than 50,000 known cases to date, largely in just a 60-day time frame. Their contacts are 50,000 sets of family, friends, coworkers, commuters, classmates, and other contacts. It's an unprecedented public health challenge, so we need an unprecedented solution to meet this moment. To do that, Illinois will be building on our existing infrastructure and expertise to shape a massive statewide contact tracing operation, gradually building over the coming weeks, and then scaling up an army of contact tracers by the hundreds and then by the thousands. Right now, based on our current rates of spread, we're looking at a benchmark that could approach 30 workers per 100,000 residents. But to be clear, that number can and will diminish if we see greater success in our public health measures, particularly our new face covering requirement. Already, we've identified groups of Illinois residents quickly willing to scale and be part of our efforts: undergraduate and graduate students, volunteers, retired health professionals, local health officials, community health workers, and new hires. And if you're interested in being a part of that, keep an eye out for more information on how to get involved in your community in the coming weeks. A significant part of this program involves technology. When an individual tests positive for COVID-19, a contact tracer will reach out to them through an app, through email, a text, or a phone call. And because not everybody can or will use technology, some will require follow-up even with a safe in-person visit if the COVID-positive person can't be reached in some other way. Then step 2. Interviewing the COVID-positive person, asking them to gather their contacts and retrace their steps over the past 14 days. This is what allows us to significantly slow the spread of the virus, because connecting with those who've been exposed allows us to do 3 important things. 1, notify them that they've recently been in proximity of someone who has tested positive. 2, recommend that they seek a test and self-isolate. And 3, offer them resources on how to access any needed assistance to prepare them for self-isolation, things like alternative housing, food delivery, or medication. Privacy is an important aspect of maintaining trust in contact tracing. So to be clear, contacts will remain anonymous. Looking backward and pointing fingers doesn't help anyone in this situation. It's about what we do next to keep each other as healthy and safe as possible. Remember, we aren't reinventing the wheel here. Contact tracing has been done in every pandemic and major outbreak for many years. In fact, that's why Dr. Duffy is an experienced expert at it. And in a moment, I'll ask him to talk more about our efforts to build out contact tracing in Illinois. Finally, I want to take a moment to recognize a very extraordinary group of people. Today, the Illinois State Police, consisting of the finest troopers in the nation, will be welcoming 92 cadets into their ranks. 92 cadets who completed their training in the midst of a global pandemic will take their oath and join the ranks of our proud Illinois State Police. As these are unusual times, so too is this milestone. For the first time in the 98-year history of the ISP, there will be no graduation to celebrate the completion of their training. For the first time, there will be no class picture, no speeches, no family in the audience proudly watching them as they cross the stage and take their oath. And in the very act of accepting their mission in this way, at this time, these officers, these troopers, are launching their formal careers as members of the Illinois State Police as they will live it, in great service to us all and great sacrifice. When I became governor, I committed to rebuilding the ranks of our Illinois State Police, and these 92 cadets are helping fulfill that commitment. It's an investment in public safety that will serve the people of Illinois far into the future, long after this pandemic has passed. So to the newest members of Illinois' finest, God bless you and your families, and God bless the great state of Illinois. And thank you. I'd like to turn it over now to Dr. Duffy. Doctor.
Good afternoon. So what is contact tracing? Well, contact tracing for communicable disease is a core public health activity that has been practiced since the early 19th century. In the context of COVID-19, it is the process of following up with contacts who may have been exposed to a person with suspected or confirmed infection. Please note that local health departments have well-trained staff who utilize the principles of contact tracing daily in their work. They use it to perform partner notifications for diseases such as HIV, syphilis, and tuberculosis. And this makes our local health departments the ideal core essential partner to serve as the hub of our activity in Illinois. How does contact tracing work? Well, our governors quite clearly described how it will function in Illinois, but there are some things I wanted to emphasize. The issue of privacy. To protect patient privacy, contacts are only informed that they may have been exposed to a patient with the infection. They're not told the identity of the patient who may have exposed them. Another essential aspect of our contact tracing program is that contacts will be eligible for testing, and if that test should return negative, then they could be released from isolation. So how has Illinois conducted contact tracing to date? Well, I want to be clear that from the very beginning, local health departments have actively attempted to follow up and interview each case as soon as possible and identify all close contacts, including those from the home, healthcare exposures, and employment. Early in the pandemic, IDPH alerted local health departments as soon as tests were positive, and the local health department attempted to contact cases upon receipt of those results. The case was interviewed to determine onset and movements, and then all contacts identified from the date of onset and 48 hours prior to onset. Those deemed to be close contacts were asked to self-quarantine, and cases were isolated. Contacts are quarantined for 14 days from the date of last exposure. Contacts can choose to be actively symptom monitored by being contacted by the local health department 2 times a day, or by receiving an email or text from REDCap, which stands for Research Electronic Data Capture. The local health department can monitor compliance and presence of symptoms in REDCap. The local health department also communicates with the case and the identified contacts placed in quarantine and educate them on how to safely isolate, quarantine at home. The local health department will address any needs for provisions such as food, laundry, medication, if no one else is available to provide those services. So, as the number of cases increase over time, we have responded by developing a hub and spoke model, plan of action. The core will be the local health department, who will provide oversight, localized strategic direction, leveraging relationships with local community partners, and the spokes, for example, federally qualified health centers, community health centers, will provide deep community connections, teams of trusted messengers, and they have the ability to be very responsive. The umbrella of the hub and spoke will be the state, and the state will provide for consistency across several areas, including resources, curriculum, and technology, for example. Why is this important for the current COVID health crisis? Well, it is how we break transmission, and it's how we make sure that we don't have a large outbreak ongoing. Given the magnitude of the COVID-19 cases and plans to eventually relax mitigation efforts, such as stay-at-home orders and social distancing, communities need many trained workers. These contact tracers need to quickly locate and talk with patients, assist in arranging for patients to isolate themselves, and work with patients to identify people with whom the patients have been in close contact so the contact tracer can locate them. Fortunately, in Illinois, we're very resourced in terms of having experts to help guide us in this. So we're working with modelers from the University of Illinois, University of Chicago, and Northwestern, who have used simulation models and simple assumptions around key contact tracing parameters to approximate the daily number of caseworkers needed to perform contact tracing through the duration of shelter in place. Just to be clear, the actual number of staff needed is large and varies depending on several factors, including, but not limited to, care-seeking behavior, the daily number of cases, time from symptom onset to testing, the number of contacts identified, how quickly patients are isolated, contacts are notified and advised to stay home, self-monitor, and maintain social distance from others. And since these numbers change daily, certain assumptions are made in the calculations. So, for example, current prevalence. We assume that a staff works 5 days a week. We assume that a staff can make 20 phone calls each day. We assume that caseworkers will have 4 days over which they need to identify contacts, and this is a nearly optimal situation in which tracing begins 2 days after symptom onset, which is approximately 4 days after infectiousness. We assume each index case contacts 2 to 3 unique people per day, and this number would rapidly increase when shelter in place ends. For every positive test, there are 4 negative tests based on current cumulative test positivity rate of 23%. So the test needed is equal to the number of true symptomatic cases times 5. And this actual ratio is likely to rise once testing is further expanded. So in reference to the governor, we are using a benchmark of 30 workers per 100,000 population. Illinois has a population of 12.7 million residents approximately. So doing the math, 12.7 million divided by 100,000 gives 127. If the benchmark is 30, you multiply that out, you get 3,810 individuals as our estimate of how many individuals will be needed. However, note well that these individuals do not have to work continually because we're driving down the numbers testing positive because of the continuance or adherence to non-pharmaceutical interventions. They do not all have to be hired all at once, and so the numbers speak to the total over time. It is also very reasonable to start with an initial number, say 10% of that total, say 300 workers, but they're strategically placed in the regions that are most impacted. By working with the many individuals and institutions which I'll detail below, we will have the capability to surge as needed. Think of how we use a National Guardsman. Think of this as a dial and not a switch. Also, by deploying technology as a first contact with individuals, the number of workers needed will be fewer. We plan to implement a virtual call center, which will enhance efficiencies, and only the most hard-to-reach individuals will actually require a visit. So imagine a homeless individual, someone with no connectivity, or a very ill person. To always be on the leading edge of the pandemic, we've organized the IDPH staff into a command center of subject matter experts who are tasked with reviewing data daily and be ready to make recommendations based on chosen indicators of success, the umbrella. So who will be engaged to assist with contact tracing in Illinois? So contact tracing is a skill that can be performed by anyone who's bright, interested, and has a charming personality. We will hire people from every region of the state using mechanisms that are fast and enable quick onboarding. The core personnel for contact tracing efforts lies in 3 cadres. First, case investigators. These are the individuals, staff who reach out to individuals who soon after test results are reported as positive. Second cadre is contact tracers. They will call individuals who have been in close contact with a diagnosed case and ensure adherence to protocol and follow up as necessary. And the third cadre are resource coordinators. And these resource coordinators provide individuals on quarantine or who are isolated with the relevant resources and support to facilitate compliance with our orders. So food, medication, alternate housing, for example. So where are these people coming from? Well, we've heard from a lot of people who are interested. Professional contact tracers at local health departments, professional contact tracers from federally qualified health centers and community clinics, reassigned workers at local health departments, reassigned workers at federally qualified health centers, skilled community members such as community health workers, social service professionals, and other allied professionals. We have heard from recent graduates and students from public health training programs as well as allied health professional training programs. We have volunteers from Illinois Help who are interested, and they're also established as well as new training programs at regional training centers. To be done effectively, it requires people with standardized training and scripts, supervision, and access to social and medical support for patients and contacts. So what are some of the additional needs for contact tracing? Well, communication with the public is essential. To be successful, a community will need public awareness and understanding and acceptance of contact tracing and the need for contacts to separate themselves from others who are not exposed. Community members need to take responsibility to follow the guidance from public health agencies. Data management and technology is needed. Case investigation, contact tracing, contact follow-up and monitoring will need to be linked with timely testing, clinical services, and agile data management systems to facilitate real-time electronic transmission of laboratory and case data for public health action. And finally, ongoing monitoring and assessment of contact tracing efforts will be needed. Public health agencies and their partners will need to monitor some key components of their programs to improve performance as needed and to determine hotspots and vulnerable populations at risk. I yield to our governor.
Thank you, Doctor, and happy to take any questions.
Governor, thank you. So how soon are they hired? How soon are they trained? How much does this cost?
I'll take the cost question, but I'd like to turn it over to Dr. Duffy to talk about how soon it can be spun up, if you don't mind, Doctor. Training and so on.
So the length of training will depend on the skills, your skill level that you're starting off. Some of the components of training will involve, like say, basic computer skills, privacy and confidentiality. So you can imagine someone who's a graduate student, for example, or someone who's a retired professional, someone from a local health department. They already have many of these skills. We would just have to tailor it for the COVID pandemic. There are established training programs on pandemic training that's already ongoing. And so once we identify individuals who are ready and able to go, we can start as soon as possible. There are just other pieces that are important to put together. It's not just contact tracing that's going to help us beat this pandemic. Issues of testing, for example, the technology piece are also important. But fortunately, we have been discussing and we've already started thinking about some of these things and how we're going to make it equitable across the state.
Is there a target date to begin?
Well, we'd like to start at the end of the month, right? We'd like to start at the end of the month and possibly with a soft rollout. So we're getting all the pieces that we need together and trying to uncover any potential limitations that may arise before we actually roll out.
Thank you. And then the cost, Governor?
Yep, happy to take that. So we're kind of look at what Massachusetts did as a model. They have more than 1,000 workers. They, of course, have technology which costs the same no matter really how many are on it. And so if you look at what they budgeted for it, it was about $40 million. Ours probably will be twice that. And so the guess is that this will be somewhere in the neighborhood of $80 million. We have not gotten a perfect budget yet because truly the technology solutions for this, there are several, and we're still evaluating those and deciding what the cost of that will be. And then it depends on the mix of how many people are volunteers, how many people are people that we're hiring that need more training, and how many less training, because the cost of putting someone through that training, we'll be paying them, during a portion of that, and so it costs less to train somebody that already knows the job, and more to train somebody that doesn't.
And the extra cost, the doubled cost, is because more workers, or what?
Yeah, exactly. It's a larger state. We have a much larger state. Yeah.
Obviously, you've seen outside, I would think, when you arrived at the Thompson. If not, there's a rather large crowd. They've been here all day. They've also been at the state capitol. Lots of frustration. Don't they have a point that some places in the state, and I have multiple questions, I could name all the people, but everyone asking, why not go ahead and open the regions where the hospital bed use is low, where the ventilator use is low? Why not?
So let me begin just by saying that there are a few hundred protesters today, both here and in Springfield, and they're exercising their right to free speech, and I'll defend to the death their right to exercise that right, even when they're wrong. But I'd like to call everyone's attention to the millions of Illinoisans who are staying at home and helping to keep people safe and healthy. They're the ones who deserve to be commended today. They're the ones who are keeping people from getting sick and dying. As to the question of regionalization, which, by the way, many of the signs and the people out there are not talking about that. They're really not. They're just saying, open everything up. They have some concept that somehow that's going to be safe for everybody. It is true that in areas of the state where we have a lower number of COVID positive cases and a lower number of deaths, those are the more likely areas that we're opening up. And you saw that I made changes in the executive order that was put forward today that includes things like opening up state parks, which are downstate, not in Cook County, and that open up things like golf courses and other things that are easier to open up downstate than they are in the collar counties or Cook County. And of course, the same thing is true of the elective surgeries. That it's easier to open up those hospitals downstate to elective surgeries, and many of them need it to stay solvent. And so we are, in fact, looking at all of the ways in which we can take into account the local circumstances in every part of the state. But I do also want to point out to people that while it's true there are areas of the state that have a low case count and a low infection rate, there are also areas of the state where you would say they have a low case count, a low death count, but it's a very high infection rate, and the percentage of people who are dying is higher. So look at Cook County versus some of these other areas in terms of infection rate or the doubling time, and they're doing much worse or the same as Cook County or the collar counties. And so we want to be careful looking at this from a hospitalization and hospital region perspective, rather than simply saying, well, gee, this is Southern Illinois and therefore we should open everything up because there are only a few cases. Well, those few cases may only be a few cases, but among a very few population also. So we're being careful about this. We are, in fact, working on the plans for opening up, for working, we're started with the president's plan, Dr. Fauci's plan, thinking that, we have to get past the peak, which we're not past, downstate or in Cook County or in the collar counties. We're not past it yet. And once we get past that, a consistent downward trend of those numbers gives us the indicator, let's move to the next phase.
What about those regions, as Eric Hong suggests, Indiana is saying today with their plan? If that region has passed its peak, could that region open before May 30th?
Yes. I mean, we absolutely are looking at all of the hospitalization numbers. Remember, it has to do with how many hospital beds are available if there's a surge. How many ICU beds are available if there's a surge? How many ventilators are available in that area if there's a surge? Because it's one thing to say, well, half of our hospital beds, our ICU beds are available, but if that number is 35, right, that's a very small number. And if the population, is such that the 35 beds wouldn't be able to cover that population if there was a surge, then we are concerned about an area. So it has to do much more than just a population in an area. It has a great deal to do with how much healthcare is available in that area.
So I just want to make sure I'm hearing that right, because that sounds like news to me, that you're saying before May 30th, if there is a region with low hospitalization, low ICU, availability of ventilator, that region may open.
Yes, if it's heading down the other side of this slide that even the national plan proposed, that is, if it's 14 days on a downslide, right, of those numbers, then absolutely listen, I want, as much as everybody else does, for everybody to get back to work and for us to move toward normalcy. But I also want to say that I'm not going to do it until we know people are safe, and it isn't going to be because some protester has a sign that says, liberate Illinois.
All right. From Elizabeth Matthews at Fox. This afternoon, there's been a new lawsuit filed. Can you respond to the lawsuit filed on behalf of the town of Cicero regarding the City View Multi-Care Center, where there has been a severe outbreak of coronavirus? Attorneys believe that IDPH failed to act to complaints, and should the residents there be moved to an alternative care facility like McCormick Place?
I'd like to ask Dr. Ezike to answer that at IDPH.
So again, it's a very unfortunate situation that, again, we all know that our long-term care residents they're the most vulnerable. They've suffered the heaviest losses, specifically regarding this Cicero locale. Yes, there was a major outbreak there, as there have been over 500 outbreaks, I think, through the state. So it's a major issue. We're looking into it. Again, people think that, if we identify some cases, if somebody comes in, they should be able to stop it immediately. Unfortunately, the way this virus works, the way, the pandemic is working, once you already have some cases, you're just trying to mitigate given that people were already spreading potentially even before they were symptomatic, people have probably already been infected before you walk in the door. And so it's just a matter of, again, trying to mitigate or control. So unfortunately, there's not a way to turn off the outbreak as soon as you get in, but you try, again, to mitigate, to decrease the number of people, additional people who can get sick. So again, we'll be working through that situation along with all the other situations, and I'll leave it to the legal team to deal with whatever lawsuits there might be pending.
And McCormick Place is an option for perhaps some of those folks?
So when we think about McCormick Place, we were thinking of that as an acute care facility for people who were on their way to home. And so when you think about what nursing home patient needs are compared to what is available at McCormick Place, depending on the level of independence of the nursing home patient, it may not be a suitable location. The rooms that are currently in use, you'd have to walk, down the aisle, down the hall to get to a bathroom. They're not beds that could protect against ulcerations for people who don't move well. So thinking about these cots would promote bed sores in a certain population. So we have to think about all those things in terms of, like, could they go to McCormick Place? But again, we're working through that very difficult issue along with many of the other outbreaks that we're dealing with throughout the state.
Thank you. Governor, in the new order that is effective today, you have clarified that worship services can be held with 10 people. Those who filed their lawsuit yesterday feel as if you've caved to that pressure. Could you react to that, please?
No, all we were trying to do was to make more explicit that people do have a right to gather in groups of 10 or less. That is the case in the other orders too, but we wanted to make it more explicit that you can worship in a group of 10 or less just as you could, as long as you're socially distancing, to be clear. But we just wanted to make it more explicit, as we have in some other areas of the new order.
All right, let me get to some of the others. Lourdes Duarte from WGN. The numbers reveal that large Latino communities are seeing a spike in the confirmed cases in the last few days. How do you tackle that spread in their communities, especially with the challenge of language? Some of the top zip codes are Latino communities.
That's right, and this problem, this challenge for communities of color is well known to all of us now, right? I think we've paid attention to it for quite some time now, understanding that the numbers really have been increasing as we increase, by the way, the number of tests that we're doing. So we've opened up testing centers, for example, in predominantly Latino communities, to make sure that we're getting the right information and that we're able to identify people who need to be treated or need to be told to self-isolate and so on in these vulnerable communities. And I'll add one more thing, and I'd like to turn over to Dr. Ezike, who pays very close attention to these numbers too, just to say that one of the things that I've been engaged in is trying to get the message out, the word out in these communities, talking directly through Univision and other outlets, and making sure that our message is, I'm sorry? Telemundo, thank you, yes. And trying to get the message out to, home team, right? Trying to get the message out that people do need to pay attention to this, that they need to follow the rules to stay at home, and that, there are various ways to seek testing and to make sure that you're getting the right health care. But let me turn it over to Dr. Ezike if she has additional comments.
No, as the governor correctly stated, as we do more testing, as we put testing in all different communities, including in predominantly Latino communities, we're finding it more. And actually, one of the beautiful things about the Latino culture is their family cohesiveness. And so the situation where you have multi-generational living in the same home, where you have, grandparents and parents and grandchildren living together, it means that there's going to be easier spread. So if you have a family of 2 people versus a family of 8 people, obviously you can think about the household contacts being the closest contact. Of course, it's going to be, you can imagine that in a family of 2, that other person probably will catch it. In the family of 8, you'd be concerned that all those people will catch it. So the rate of spread could be bigger because of the cohesiveness of the family units in that culture, and so that might be part of it. But also, again, we're finding out cases now as we make more testing available. Remember that we were testing maybe 5,000 specimens approximately per day, and now we've averaged over 12,000 for the last week. So again, we're finding out what's been there, but it's important that we identify those people. It's important that everyone knows that they can get care and that everyone who has COVID-19 will be covered, that there is no reason to avoid getting the care that is necessary.
And I would just point out one other thing. As many of you have seen every day, Dr. Ezike translates her remarks, which are the medical update, into Spanish, specifically speaking to Spanish-speaking populations, and that at IDPH we have translators for people who need help to try to communicate and get the right information about how to treat their COVID-19 or if they've been in contact with somebody.
Governor, there's so many questions, again, about unemployment. That is the persistent question that everyone gets, all of my colleagues. Dana Kozlov today has a question that is, IDES says virtual call center and new PUA computer system is on target for May 11th, but we are hearing gig workers should not expect to get money by that date. Can you clarify?
Well, people need to, I can't speak to what date on which they will get, their cards would be charged. What I can say is that, that we are going to be launching that, but we would ask all the gig workers, something very important for people who are independent contractors, who are eligible, could be eligible. They need to actually file their unemployment claim now under the current unemployment system, because it will make it much easier when we actually launch the independent contractor system for them to get paid. So file now, you'll get a rejection. And we've said this many times. You will get a rejection because you're not currently employed somewhere that's, that's eligible. And then by, in that May 11th week that we'll be launching independent contractor payments, they'll be ready to go. They'll have an account already set up.
Chris Ty, CBS 2. What about cities and towns struggling to enforce mask or face coverings? Will there be a fine? Will there be arrests? Are the police going to get involved, as you've now required starting today?
We've left that up to localities, to municipalities and counties to make those decisions about how they will enforce, whether it's, as I've often recommended, having police, tell people, pull over, ask them to please wear a mask, to remind people, because a lot of people still don't know that they're required to wear a mask. Today is the first day that is required. A face covering is required, even though, as you know, for weeks now, I've been encouraging people to do it. And many people, as I see, are, not the protesters, of course, but many other people are wearing their face covering. So, again, the enforcement will be up to local municipalities and local counties.
Center Square wants to know about State Representative Bailey's lawsuit. Today, he voluntarily withdrew his TRO, inferring that your office and others may have illegally kept information from the court. If he has documents proving the state willfully committed this kept the evidence, how will you respond?
I can't answer some hypothetical. I really don't know what Representative Bailey's intention is by withdrawing his lawsuit. I'm glad that he did, but I know that he intends to do something else. I'm not sure, again, if it's more grandstanding or what.
But there is the second lawsuit that takes in everyone. Do you have any update on where that stands?
No, although I did read that that lawsuit is not intended to be adjudicated anytime soon.
Stacy Baca from WLS. Ravinia is now canceled. Isn't it time to make the call on all music festivals, block parties, events that draw thousands, Lollapalooza, let's throw that in there too. Isn't it time? Ravinia is not going to happen. Why should anyone expect any kind of large gathering then?
All I can tell you is that, we currently have an order in place that goes through May 30th that is that makes it clear that gatherings of more than 10 are inappropriate, are against the order. And so I can't tell you what July or August will look like yet. And decisions will have to get made either by municipalities or by the promoters of those concert venues or large gatherings at this point.
Eric Rung from WGN. There have been a number of emergency cases concerning COVID-19 when it comes to parental custody. There is a real concern from both attorneys and parents that some are using your stay-at-home order to sidestep custody agreements and deny parental rights. Is this something the governor's office or your team is looking into, and how can you protect parental rights during the pandemic?
Appreciate the question. I don't have an answer for it. I don't know the details of it, but I certainly, now that the question's been asked, I'll look into it. The likelihood is that our legal team knows about it.
Blue Room is asking, perhaps is there a need for more training at grocery stores? They especially see grocery store workers touching their face, touching the items. People don't feel safe. Is there more training needed for sanitizing?
Let me begin by saying that this pandemic was a surprise to everyone, including the grocery stores, the grocery store workers, everybody. And so as we worked with the Illinois Retail Merchants Association and connected with grocery store owners across the state, we've encouraged them to follow a set of guidelines. Many of them really have done yeoman work in getting that done. And so I would say it's absolutely true that many people can go into a grocery store and see something a worker does and say, gee, I wish they hadn't done that or wouldn't do that. And certainly not wearing a mask is unacceptable, not wearing a face covering for somebody who's working there and somebody who's shopping there either. And so there may be a desire for more training, and I certainly would encourage the owners of grocery stores, as well as pharmacies and other places that have been open under the essential business openings. And this is going to have to happen across our economy, I might say. As we're opening retail and other things, manufacturing, professional offices, and so on, people are going to have to be trained. This is so new for everybody. Even wearing a mask, even a face covering, is so new that certain kinds of jobs are going to require gloves and a face covering. Certain kinds of jobs are going to require people to have a much more sealed face covering than the kind you might wear when you're outside on your own, taking a walk or going to the grocery store. So there is going to be a lot more training that's required.
And just, there's several here, and this is my last one, is both Mark Maxwell as well as Amy Jacobson, they're asking, again, ventilator use is down. You sent ventilators back to California. Mm-hmm. There are open hospital beds and ICU beds. 23% of all hospital beds in use. The curve is flattening. Just one more time, why continue the lockdown?
Well, they think that maybe they think that's an accident. I think it's an interesting pair you just threw up there, Mark Maxwell and Amy Jacobson. But I would say that look. All I can say is this: we have bent the curve. That's what's happened. The stay-at-home. It's not an accident here that. The number of deaths that was expected is many fewer, that the number of ICU beds that are filled, many fewer, ventilators, many fewer needed. It's not an accident. It's not an accident. And it's not like this virus has gone away either. It's because people are adhering to the norms that we've put out there. And we've asked people to wear face coverings. We've asked people to wash their hands. We've asked people to stay home. It's very difficult for everybody to have done that, but they are doing it, and that is succeeding. And so people should understand the relationship between the bending of the curve, the lowering of the need for ventilators, and the fact that we have these mitigation efforts that are working. So when we say, well, gee, let's end the mitigation efforts, guess what happens in the absence of mitigation efforts? The rate of infection goes up again. The R0, as we've called it, goes up. The number of ventilators, ICU beds, and hospitalizations goes up.
Dr. Ezike, I'm sorry, this is the final one. Folks are wondering, they keep a look at the numbers. They don't think they always add up to what they see and what they've been keeping an eye on. If someone dies from coronavirus in a different state, but their ID says they're an Illinois resident, does that go on the Illinois death count or the state where the death took place?
Right, it's actually your home residence. So a lot of times we'll get information, and if by the time you look at it and figure out where people are from, then you have to contact our equivalent partners in the other states and let them know. They have to adjust their count. We have to adjust our count.
Thank you.
All right, Jim Haggerty at Rock River Times. Governor, Rock Cut State Park near Rockford is now open, and it was initially not on your list of parks that would open May 1. What changed in your decision to open that park?
These are decisions that are being made by the Department of Natural Resources, and as they're able to figure out how to staff these parks properly, which entrances to have open and closed, and what activities can be done in a park safely.
She at Politico, there's been a lot of talk about grocery store and restaurant workers being the heroes in this pandemic, but they are still at the bottom of pay, benefits, and protections. Will the revised state budget address any of those issues?
I hope that we will be able to recognize the heroes here. You know that we have challenges with our state budget that we're going to have to address. But the people who have come out and done this amazing work in this very difficult time ought to be recognized, and I'm looking at ways in which we could do that. I would ask employers to recognize them as well.
Dave McKinney at WBEZ, can you say if either laying off state workers or skipping payments to the state pension system are options you're weighing to fill the budget shortfalls you've ID'd? Also, what specific things do you want lawmakers to act on when they return to Springfield?
I'm not looking at skipping pension payments. What was the other question that was asked?
Or laying off state workers?
Laying off state workers. Look, we have to look at everything, but that is not something that we're currently looking at. Remember, in a pandemic, and this thing is ongoing, it's not going to leave us, you need state services more than ever. Think about the damage that's done if we lay off state workers in areas like DCFS or in domestic violence and in challenging domestic violence and overcoming that, in dealing with our healthcare system. This is not a time for us to further defund and further hollow out government from where it already has been at a relatively low level.
Dave Dahl at WTAX. Governor on Wednesday, Hammond said the people in her district, quote, boots on the ground, know more about what's good for her district than someone governing from a podium in Chicago. In your words, what is she missing?
Well, I've been happy to be in contact with Rep. Hammond actually just in the last 24 hours, had a very nice conversation with her, exchanging ideas about how we could open things up, the ideas that she's getting from her constituents, including, as you're implying, that they know what's good for their area. That's true. I think what they maybe don't have access to is the epidemiologists and the scientists and the data. And so, we're looking at that to make sure that we're keeping everybody safe in her district as well as every district, but evaluating and trying to weigh, against we have epidemiologists and data that may say one thing, and a desire, as I do too, a desire to let everybody get back to work, and so we're balancing those all the time.
Kevin from WMBD in Peoria, what are you planning on doing now that the East Peoria mayor said this morning he's going to defy the stay-at-home extension and allow more businesses to reopen beginning today?
Look, people who defy the order and who simply go out and go about their business as if there's no pandemic, and certainly leaders who are encouraging that. I would suggest that it's a good thing that we've expanded testing across the state, because a lot of people are going to get sick and need to be tested in those areas. And frankly, it's a good thing that we've left hospital beds available for people, because they're going to end up in the hospital too.
Kelly at Block Club, rent is due today. What is the state doing to help renters and homeowners or to pressure the feds for more help?
Mm-hmm. First, I would say through the Department of Human Services, there is a rent subsidization program that people should access if they need help, and many do. It's not a big enough program. We doubled it for this current fiscal year. It had been doubled, and we'll look at what more we can do within that program within this fiscal year. There is no doubt about it that, as we have banned evictions in the state, that is one way in which we have tried to push off everybody's challenge of having to pay rent right now, because too many people are suffering from the current economic situation and challenged in their current housing. But as we go forward, we're going to look for more. The federal government has provided us with some dollars, but it has been only COVID expense-related dollars. And that's why I've been so vocal about the federal government needing to step in and help local governments and state governments so that we can do more to alleviate the burden on working people across the state.
Bruce Rushton at Illinois Times. 2 weeks ago, you supported efforts to shut down a drive-in Easter service and compared cars to pews. Yesterday, you issued an order encouraging drive-in services. Why the change? Have your thoughts evolved, or have the lawsuits filed by churches persuaded you?
I'm listening to the science as it's evolved. As you know, there in many states, there are experts, and nationally there are experts who have said that it's more dangerous to do one thing than another. And, as the thinking about this has evolved, I obviously am listening to it. This is a novel coronavirus. It's to remind everybody we're doing the best we can to make decisions as the science dictates. And so, we want people to be able to worship. We do. We want people to do it safely. We hope that the parishioners and their faith leaders will follow the guidelines that are being suggested by the science and the data.
Jim Leach, WMAY. Governor, we know you've heard from people wanting your order changed or lifted. Have you heard from business owners or others supporting the order?
Many people. In fact, the vast majority of people that we hear from are people who support the order, want us to make sure that we're continuing to evolve the order, but believe very strongly that keeping people safe and healthy is the thing that we should balance more in favor of today as we try to look at all the treatments that may be available. I want to remind everybody that, as I have said for weeks and weeks now, that in addition to testing and tracing, having a treatment available would really make all of what we hope to do here much easier. An effective treatment. Now, we've just heard recently, some have been reporting on TV, on the major networks, about certain kinds of treatments that have proven effective or more effective than others that may be receiving emergency authorization from the FDA. And I'm so pleased to see that, because we all if you can add that to the testing and tracing, as I've said, the 3 T's are critically important for us to really open up the economy.
This will be our last question. It's from Rich Miller at Capital Facts. Why has Illinois not waived the WARN Act notification requirement? As soon as businesses were forced to close, they were in violation of the act for not giving 60 days notice.
We have loosened the requirements on people during this, that they are still notifying us, but not required to fit entirely within the regulations of the WARN Act. So we haven't done away with the WARN Act, but the enforcement of it has been severely loosened, and we've talked to many businesses that have called about that.
All right, thank you.
Thank you.